Hi, I'm Catherine.
And I'm Laurel. We're both PA students at Butler University in Indianapolis, and we're here at the Cardiovascular Institute with Dr. Ben-Zur doing a rotation here, and we wanted to make a video about the plant-based diet to sort of address some of the common questions that we get from patients, to sort of explain the why and sort of give some advice on how to make it easier to get started and all the benefits behind doing it.
So the plant-based diet, if you've ever been a patient here before, we're really into this at the Cardiovascular Institute for many reasons. But one of them is that this is one of the easiest and the most important modifiable risk factors that we can affect by changing behaviors. So the way that we do that is we move to this plant diet, which is exactly what it sounds like. The plant diet includes primarily vegetables, if you kind of think it as like a tiered system, with the biggest tier including the vegetables. And then as you move up the pyramid, you're thinking less and less of the other foods like fruits, some legumes, some beans. But really what it comes down to is you are trying to find foods that are the most natural and the most wholesome and close to their original state, and essentially saying no processed foods. That's really the ultimate goal here, but pushing the vegetables is very important.
And no plant or no animal products at all. No meat, no fish, no milk, no eggs, no cheese. Literally just plants, fruits, nuts, legumes, beans. And so with that being said, why do an all plant diet? What are the benefits? Why do we ask our patients to do that? Why do we encourage them to do that? And really there are so many benefits. The first, of course, this being Cardiovascular Institute, is the impact it has on your heart and your blood vessels in your body, and how that has a direct impact on your quality of life and your longevity of life. We have patients come in, and within 2 weeks, they also are telling us that they have more energy, they've lost 10 pounds. You just see this really immediate effect it has on people's lives. So we also very often have new patients come in, and they come in with, a med list of 15 different medications that they're on, and within those 2 weeks or to a month that they're starting an all plant diet, their blood pressure normalizes because they're not eating so much salt anymore, and so they can come off their hypertension medications. Their blood sugar normalizes eventually because they're eating mostly plants and vegetables, and no more processed foods, and so they can come off metformin or whatever other diabetic medicines they're on. Their lipids and their cholesterol start to normalize, and they possibly can back off on some of their statins that they get to do. And so we just see these patients that slowly they can just chip away at their medication list and go down to 3 or 4 of just really only necessary or beneficial medications. And it's just a really amazing thing to see.
Yeah. Those are some of the things that you can visually see, but some of the things that we can also see that are a little bit more internal that we see on scans or images is that a lot of foods, especially meats, are associated with inflammation in the body. And if you have inflammation and you already have heart disease, or you don't know you have heart disease, or you're likely to develop it, this inflammation can lead to atherosclerotic plaque buildup. And if this plaque continues to build and build, we're blocking vessels, it potentially can rupture or break off and travel throughout the body, and you end up with heart attacks and stroke rates increasing. So that's kind of another side effect that we see. Another thing to think about is a lot of processed foods, especially processed meats in particular, which are common in salads or on sandwiches, have been linked to various types of cancer, especially like stomach or gastric cancer. So there are a lot of links to processed foods that are not widely advertised enough, I think. So those are all the more reason that you really need to transition to a plant diet.
Yeah, and just to speak to that a little bit more, first with the plaques, like Catherine mentioned, it causes inflammation in the body, so it causes those plaques to build up, and then that added inflammation makes them more prone to rupture. So it's not just that you're getting plaque buildup by introducing more and more cholesterol into your system by eating things like cheese and red meat. You're making them more sensitive to rupture and causing those terrible side effects of like MIs and strokes and stuff like that. And then you're not just, preventing those things from rupturing, but we actually see it reverse. We have patients come in who have, a 70% stenosed coronary artery, has 70% blocked where blood can't flow through. And we stented him. He started an all plant diet within a month even, or 2 weeks, he started feeling better, like I mentioned earlier. And his plaques start reducing. We have literal before and after pictures of his vessels with a blockage and then one that's just wide open. So it doesn't just stop plaques from rupturing, it actually can reverse them and in a sense almost cure that heart disease. And then with the cancer, we also see studies, yes, linked to gastric cancer like that. Charred meat has been linked to cancer, certain types of breast cancer. Oh, I said, yeah, charred meat, yeah. Certain types of breast cancer have been linked to meat eating. So you're really reducing and reversing your coronary artery disease, and you're preventing cancer. So there's just so many benefits, and you're going to feel better, and why not do it, you know? It's your life, and you have to figure out what motivates you and be here, and a plant-based diet can really help get you there. So with that being said, we wanted to address some of the more frequently asked questions we got from patients who are just maybe struggling to get started, trying to figure out how do I get my footing into this. And with that being said, just as a disclaimer, whenever you're starting a new diet like this, you should be followed by a doctor, whether it's your cardiologist or your primary care provider. You want to establish that care and let them know that you're changing your diet. So if there are blood tests that need to be done or closer monitoring, especially if you're a diabetic, sometimes cutting out everything right away as a diabetic can really make your blood sugar drop. So be careful there. Sometimes a gradual change into these diets is what's necessary. So just let your regular doctor or any doctor really that you go to regularly know that you're doing a diet change before starting anything.
Mm-hmm. So two of the most common questions that we get from patients are, what am I doing to stay full, and what am I going to do for protein? And those two kind of are commingled. So to answer the first question, how do I stay full? So we highly recommend on a plant diet that you actually eat every 2 hours. And the reason for that is, the food is kind of in its original best state, and so your body's able to process it a little bit faster. So that, in that respect, you're gonna feel like you need to eat more frequently, and that's okay, because you can't overdo it on vegetables. And if you're eating a balanced amount of, fruits and nuts and beans and legumes, then you're gonna be okay eating more regularly and not eating 3 large meals of the day. The second part of that in terms of the protein, so protein, most people, say, I get it in my chicken that I eat, or I get it in the meat that I eat. Well, you can actually get that just as much, if not more so, if you're eating certain vegetables like spinach and kale, and, adding in a little bit of quinoa or things like that to really supplement the protein. Beans also have a tremendous amount of protein. So you're going to be well balanced as long as you're consistently eating the right foods, especially the vegetables, as well as varying the types of veggies that you eat. Then you won't be short on, protein or feeling full or anything like that.
Yeah, and we also get a lot of questions or even complaints, complaints when people start saying, like, I'm getting a lot of abdominal gas, I feel kind of bloated, I feel good, but this is a little much for me. And so again, that can be addressed very easily when starting a plant-based diet. One, if you need to ease yourself into it, then do that. There are some vegetables that are harder to digest, and so maybe cooking them a little bit might help in the beginning as well. But as long as you're eating, again, consistent amounts of vegetables throughout the day, your stomach is adjusting and your colon is adjusting, and that'll pass. It will pass. So don't give up if you're just feeling that way. And you have to think of it this way as well. Your colon, your large intestine, it's a muscle just like other muscles in your body. So if you're somebody who's not used to eating vegetables, or you really only eat protein and meat and cheese and stuff all the time, you've got this weak muscle in your abdomen that's finally getting this workout. So it's gotta contract, and it builds this muscle, and it'll get there, and it'll be able to digest all that stuff. And that's actually really good for your colon, and that helps prevent diverticular disease, which are little outpouchings in your colon walls because they're weak. The muscle there is weak, so it kind of just gives out and makes these little outpouchings. So if you don't have diverticular disease, you can't get diverticulitis, which are infections which can lead to bowel perforation. So really, the abdominal problems, sometimes people think that they can't do this right because of that, but give it time, be patient, ease yourself into it, eat smaller portions, and your body will adjust.
Yeah, and one of the other things that I think kind of people are hesitant about too when starting this diet is, everybody knows somebody who's been on a diet, or they have direct experience themselves where they feel like they've been vitamin or mineral deficient. And this is actually a lot less common than people realize. If you're eating kind of consistently and very balanced in terms of the variety of vegetables you're eating, like we've kind of talked about, then you're actually less likely to have any deficiencies. The only vitamin that plants are actually that are not in plants is vitamin B. And so lucky for us as humans, we actually store that vitamin B a very long time. So the chances of you being deficient really anything is actually very minimal. And if you ever get to a point where you're just not quite there and you would really like to check, we can always do blood work every couple of years and, add in maybe some supplements if they are low. But again, it is pretty rare, and a lot of the research out there shows anyways that the vitamins are best absorbed absorbed into the body if they're in their natural wholesome state through fruits and vegetables as opposed to supplements anyways. The support for supplements in general is not that strong. So.
Yeah, and so another really common question we get, and you're just starting your day with the all plant diet, is what do I eat for breakfast? A lot of people walk in there like, I'm used to having eggs or yogurt or milk and cereal or something like that for breakfast. So like, what am I supposed to eat? If you're somebody who kind of likes that sweeter breakfast, then berries are a great option. Oatmeal is kind of an okay option. We usually don't recommend it for patients that also have diabetes because that can affect your blood sugar. But if you're doing a 100% actually all in, all plant diet, then oatmeal in moderation is okay. And when I say moderation, more like a fourth a cup at a time, and maybe once in a while, perhaps not even every day for breakfast. But a lot of patients just sort of need a mindset shift to sort of wrap their head around breakfast. So eating vegetables for breakfast is okay. It's not against the law. You can stir fry a couple of veggies, add some spices in there, and that'll be a really tasty breakfast. It's not that hard to do a plant breakfast. You just have to sort of change your thinking. Fresh herbs are really delicious for breakfast. You'll figure something out, and the internet has a lot of good ideas as well. With that, in sort of that same theme, we also get a lot of questions about what about non-dairy milks? Like how do those fit into an all plant diet? And those are fine. We have no problem with those. Those are absolutely allowed. Try to stick with your nut milks. So cashew milk, almond milk, soy milk is okay, but soy does have a lot of estrogen in it. So if you're eating soy in other settings, just try and regulate how much soy you're eating overall, because increased estrogen can cause effects on both men and women that you probably don't want. So just use that sparingly. And of course, with any of these milks, make sure you're drinking the unsweetened kind. Just the regular nut milks are great.
Yeah. So other things to think about, I think a lot of the other things that people are worried about is, okay, so I'm just eating vegetables, right? Like I can't, there's going to be no taste. I'm going to have no chance to, enjoy the variety that I used to. And that's really just not true. If you're, somebody who's maybe not used to eating that many vegetables, or you do eat vegetables, but you haven't looked into different ways to kind of prepare them, then it's kind of more of an opportunity rather than a drawback. Or don't think of it as something that you're missing. Think about it as a chance to try new things. So there are plenty of seasonings out there that are no salt, or have no sodium in them. So that's something to consider, is look for the seasonings like Mrs. Dash, or just the regular, go to a spice store and find the spices from other countries that you're maybe not exposed to commonly, a lot of them are no sodium or no salt. So those are things to kind of think about, that there are different ways to prepare foods and to season them in a way that is going to make it very tasteful, but not have any, added issues or risk factors. So that's just one thing to consider.
Yeah, and a lot of people, they have a hard time in the beginning wrapping their head around like, well, I'm really busy and I don't have time for this. I work as this person and I do these things. This seems like a lot of prep. Like, I don't have time to be chopping vegetables all day or cooking vegetables or whatever it is. And okay, that might be true, but think of an all plant diet as an investment in you and in your future and what you want to live for. So some people, they also can't wrap their head around cooking with oil without cooking with oil. And so I think a really good suggestion, if people can swing it, is to invest in a really nice pair or set of quality cookware that's nonstick. It's going to last you forever. Yeah, it might be a little expensive up front, but you're going to have it forever and you won't need oil. You can use water in place of oil. You can use vinegar, which will add some flavor as well. And it really won't be an issue. And as far as the food prep and stuff goes, in the beginning, if you just need to get in and start doing it, buy the stuff at the grocery store that's pre-chopped, or buy fruits and vegetables that are sort of ready to eat as is. Like Persian cucumbers are a great option. They're smaller cucumbers you can snack on. cherry tomatoes, small bell peppers, berries are good. I feel like I'm missing one that we always see people eat.
Those are the biggest.
Yeah, those are ones we see a lot. Baby carrots, that's what I was thinking of. Yeah. So just have those things at hand, and you'll have something to eat, and the food prep will come with time. You'll get more experience out of it. Honestly, if you are chopping vegetables all the time, you're only going to get faster, and it's only going to become more and more of a non-issue for it. So yeah, it's not as much time and effort as people really kind of give themselves an excuse to sort of back out and not do it.
And another thing I feel like that we hear pretty often in terms of reservation or hesitation for starting this is, man, I don't know, this is just really expensive, and I think we hear that a lot as a reason to never start. And I think you have to think about it this way. Like Laurel said, it's an investment, and prevention has been shown to be a lot cheaper than treatment. So if you're preventing, the cancer and the plaque buildup and all of that, you're saving yourself money way down the line. And it may not seem like it now, but this really is going to be a lot less expensive over time than it is to have long-term treatment, have long-term medications, have hospital bills. So think about it that way in terms of saving yourself now rather than later. And again, it's looking at quality and longevity and not just longevity itself in terms of life. A couple other pro tips that we like to talk about too and offer up is consider, out of sight, out of mind. And what we mean by that is if you don't have certain foods in front of you, you're not going to miss it because it takes that temptation away from you. So if you're somebody who's really social and, you like dinner parties or something like that, have them at your house, you prepare the food, you control what's being made and served, and you're more likely to be able, to be successful. And you can even get other people on board too as well, let them know what they can bring rather than, just letting them bring whatever. Another thing to think about is don't eat out for a while you're kind of getting used to the diet, so you're not tempted by what other people are eating. It can be really hard to see other people eating things that maybe you're used to eating, but over time your stomach and your body will get used to not having those foods, and you won't crave them or want them anymore. And the other kind of thing to think about is accountability. This can be challenging when you first get started. So get someone else on board that lives at home with you, or a friend or family member that can keep you accountable, but also keep themselves accountable too. So it's a lot easier to take on a challenging task if you have other people helping you, for sure.
Yeah, absolutely. And to speak to a couple more of those points, like Catherine was saying, when you're first getting started, if you're somebody who's very social and you have to go to dinner parties, host them yourself. Once you're sort of more of an advanced pro at the, plant-based diet, when you get invited to a dinner party, bring a dish that you made or your own bag of vegetables or something like that. And of course to share, but that way, there's going to be something there that you can eat and that you want to eat. And going out, once you're a pro, you'll know that you can order off menu. Every restaurant's going to have some sort of vegetable option. And you'll figure it out, and accountability is just the best. I think our patients who do the best are people who have somebody who gets inspired, as we hope we're doing with this video for people, who gets inspired with them for a plant-based diet and jumps on board, even though they don't even have any, heart problems that they are aware of at least, and jump in and making it a social thing and a team thing. Like if you are going to host a dinner party, that's plant-based, and challenge your friends to bring something that is too, and maybe they will get inspired and be like, oh my gosh, wow, I didn't realize that this dish had no meat products in it and it's really tasty, and I will totally make this at home. And even if you're somebody where you're like, well, I just I don't have somebody in my life who's willing to do that with me, like you'll find someone if you keep your ear to the ground. And of course you can always talk to us at the Cardiovascular Institute. We love to help our patients get on board with this. If you're local, you can stop by the practice at any time and we'll talk to you. We'll give you resources. You can even go online to Dr. Ben-Zur's website and the Cardiovascular Institute website, and there's a free book for you to read on there that Dr. Ben-Zur wrote, and it talks a lot about the plant-based diet, why, sort of the points you were talking about, why it's important, why it's so beneficial. It has sample recipes in there, and he has links to so many other resources that you can go to and just really get inspired and hopefully inspire other people to join in and do it with you.
Yeah. It really is an opportunity to enjoy your life longer. So just remember, consistency is important. Perseverance is really important. But you absolutely can do this, and just remember and consider all of the benefits and know that this is something that people have done and been very successful with. So we just encourage you to, really think about it, talk to us if you have questions, but, you know, start your journey, and we're definitely, you know, here for you along your journey as well. So
Yeah. So
thank
thanks
you.
for watching.